So for this video, we're going to discuss how to use a peak flow meter. And a peak expiration flow is a person's maximum speed of expiration and is measured in liters per minute with a peak flow meter. So a peak flow meter measures the degree, the degree of obstruction, airway obstruction, and are often helpful for asthmatics. Um, Everyone's peak flow meter results will be different. Therefore, it's important to get a baseline before you implement the athlete into any activity. So to measure peak flow meter, so you have the patient stand with a peak flow meter and place the peak flow meter in their mouth. So to ensure that no air will escape during expiration. And so what you want to do is instruct the patient to exhale and then blow out forcefully. And then you want to make sure that the athlete expires all the air from their lungs. So they may need a little bit of encouragement to get that last full breath out. So the goal of the peak expiratory flow is to get the maximum amount of effort the maximum amount of air from the lungs in the least amount of time. So you want them to get it out very quickly to get that accurate measurement. And so this is an example of a peak flow meter. So this is exactly what you'd want your patient to do. Standing, blow out as hard as they can and as fast as they can and get the maximum amount of air out of their lungs. And these on the scale to the side will tell you the amount of amount of air pushed out through the lungs in liters. So the better that your asthma is controlled, the better that your peak flow meter outcome will be. And while this device detects the amount of air that you push out through your lungs, it is not the detection for asthma, but it can detect small differences. And on the peak flow meter on this side, you'll see different colors. There's green, yellow, and red. And green zone indicates that you're at 80 to 100% of your personal best, which means that your asthma is under control and there's no symptoms present. The yellow zone, I think, is 50 to 80% of your personal best, and your asthma could be worsening, so you need to keep your upkeep on your asthma medications. And then your red zone, which is this red right there, is below 50% of your personal best. So get medication advice immediately and use your prescribed inhalers like albuterol and for your shortness of breath. And if it's really bad, you proceed to the emergency room or to your doctor's office. And since these green, yellow, and red indicate your personal best, your best, and you need to start taking your inhaler. You want to make sure that you slide the green and the yellow up to 80 to 100% of your personal best, and the same with the red to the yellow. And with this peak flow meter, you want to make sure that you have the lip of the peak flow meter in your mouth, and you want to make sure that not your teeth or your tongue are blocking the lip, and you want to make sure the seal around it is nice and closed. You want to make sure that you take a big, deep breath in before you place the peak flow meter to your mouth. Instruct your patient or your student athlete to take that big, deep breath and instruct them to blow out as hard and fast as they can, and make sure to get every liter of air out of their lungs by eliminating even the last few liters of air.